Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Results of the Exercise and Nutrition to Enhance Recovery in Good Health for You, or ENERGY trial, a behavior weight loss intervention in overweight and obese breast cancer survivors by Cheryl L. Rock et al. My name is Jennifer Ligabell, and I am a senior physician at the Dana-Farber Cancer Institute in Boston, Massachusetts. My oncologic specialty is breast medical oncology. Obesity is increasingly being recognized as an adverse prognostic factor in early breast cancer. A 2014 meta-analysis, including 82 reports looking at the relationship between weight at the time of breast cancer diagnosis and mortality, demonstrated that women who were obese at diagnosis had a 35% increase in breast cancer specific and a 41% increase in the risk of overall mortality as compared to women of normal weight. This finding was confirmed in a recent report from the Early Breast Cancer Trialist Group, who analyzed the relationship between weight at diagnosis and outcomes in women taking part in 70 adjuvant therapy trials. Amongst premenopausal women with hormone receptor-positive cancers, they found a 5% absolute increase in breast cancer-related mortality in obese women compared with women of normal weight. Excess adiposity has also been linked to increased risk of morbidity in breast cancer patients. Obese women are at increased risk of lymphedema and other surgical complications, such as poor wound healing and seroma formation. Obesity is also associated with an increased risk of comorbidities like diabetes and heart disease during and after cancer treatment. Despite the risk of poor outcomes associated with obesity, relatively few studies have tested the feasibility or benefits of weight loss interventions in breast cancer populations. The largest completed trial to date, the Lifestyle Intervention Study Adjuvant, or LISA trial, randomized 338 overweight and obese women receiving an aromatase inhibitor for early-stage breast cancer to a 2-year telephone-based weight loss intervention or to a health education control group. Participants randomized to the weight loss intervention lost 5.4% of baseline weight at 1 year and 3.7% at 2 years, compared with 0.7% at 1 year and 0.4% at 2 years in controls. Intervention participants also experienced improvements in quality of life and physical function. In the article that accompanies this podcast, Rock and colleagues present the results of the ENERGY trial, which randomized 693 overweight and obese women with early breast cancer to a 2-year in-person group-based weight loss intervention or to a less intensive intervention control group. The weight loss intervention was implemented through group meetings conducted weekly for the first 4 months, biweekly for the next 2 months, and then monthly for the remainder of the 2-year study. The control group received 2 individual meetings with a dietitian and materials regarding a healthy lifestyle. The group-based intervention was successful in inducing weight loss, with participants randomized to the intervention losing 6% of initial body weight at 12 months, compared with a loss of 1.5% of initial body weight in the control group. At 24 months, the weight loss intervention group had lost 3.7% of initial body weight versus 1.1% in the control group. Subgroup analyses demonstrated that the effectiveness of the intervention was strongly correlated with age, with women aged less than 45 years experiencing no weight loss at 24 months, as compared to a loss of 5.2% of initial body weight in women over the age of 55. The ENERGY trial represents the largest study of a weight loss intervention in breast cancer patients to date. The trial demonstrates the feasibility of achieving weight loss in this population, demonstrating a similar degree of weight loss as has been seen with intensive group-based programs in other populations. Accrual was successful, with almost 700 participants enrolled from just 4 centers, and attrition was relatively modest, with 85% of participants providing data at 12 and 24 months. The trial does raise questions about the success of group-based in-person approaches to weight loss in younger breast cancer survivors. There are few data from prior trials looking at the efficacy of weight loss interventions in this group, and more work is clearly needed to define effective weight loss strategies in these patients, given that recent observational reports have suggested that weight may be an especially important factor in premenopausal breast cancer patients. The ENERGY trial also raises the question of where we go from here. Observational reports continue to support the association between obesity and poor outcomes in breast cancer. These studies also point to the high prevalence of obesity in breast cancer populations, with most contemporary reports suggesting that at least 30% of women diagnosed with breast cancer are obese. Evidence is needed to determine whether purposeful weight loss in these women will lead to improvements in breast cancer outcomes. Perhaps as important, work is needed to show how best to achieve weight loss in large groups of breast cancer patients who may be at risk of poor outcomes as a result of their weight. In-person group-based weight loss interventions have been demonstrated to produce successful weight loss, but these programs are expensive and difficult to implement on the larger scale. The Diabetes Prevention Program demonstrated that an intensive group-based weight loss program led to an impressive reduction in the incidence of diabetes, yet access to this program remains limited in many areas. Although one of the most common cancers, the number of women with recently diagnosed breast cancer in a particular area is also much smaller than that of individuals at risk for the development of diabetes, making group-based programs even more difficult to implement. Future work must not only focus on whether we can help women to lose weight after breast cancer diagnosis, but whether we can do this reliably using methods that could be implemented across the diverse settings in which breast cancer patients receive their treatment. Studies employing distance-based interventions that implement weight loss through telephone and web-based approaches hold the promise to provide weight loss interventions across a broad range of geographic, socioeconomic, and cultural settings. The ENERGY study represents an important step in demonstrating the feasibility of implementing weight loss in breast cancer patients. As we move forward, we must focus on the development of programs with the potential to make weight loss accessible for the thousands of breast cancer patients who could potentially benefit in the years after breast cancer diagnosis. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.